My name's Wainrib. I'm the Clinical Director and Founder of Mobile Dental Clinics Australia. The one thing that really impresses me with Dentrix Ascend is that it's constantly evolving. There are constantly updates and improvements to the software which are always exciting, and we are able to basically take on those new updates almost immediately. And there's also a consultation process between ourselves and the developers, so we can actually suggest improvements based on our needs, and then they can be implemented into the software to make it easier for us. We were one of the first practices in Australia to join the Dentrix Ascend family. The support that we had from Dentrix Ascend and Schein was excellent. We had a significant amount of training. We are quite a large organisation, and as we have onboarded more staff, we've been able to utilise extra training facilities in order to ensure that our staff know how to use the software properly. There are a lot of softwares out there that are quite complicated, and I think considering that 50% of our workforce are non-dental, it would have been really tricky if it was a very complicated software to use. But we've managed to find that all sorts of people from a wide range of backgrounds have been able to pick up the use of Dentrix Ascend relatively easily. The imaging software is excellent. It integrates really well with our phosphor plate system that we use. We're able to manipulate the images the way that we need to in order to perform the best diagnosis for our patient. I would absolutely recommend Dentrix Ascend to other practice owners. We had a really in-depth consultation process in order to determine our needs for our practice. I didn't feel like I was going to a supermarket and picking an off-the-shelf product. I felt like it was a really tailored solution for us, and that's why when we opened our fixed practice, there was no doubt that we were going to use Dentrix Ascend, even though a lot of the other functionality in terms of cloud-based software wasn't as important. It's still been really useful for us being able to access those records remotely, and we have clinicians that work between the two practices, so therefore they can go out and see their mobile patients and have a fair idea of what's basically going to happen when they come back into the clinic.